Thanks for joining us for this COVID-19 and City News briefing for Wednesday, January 27th. We will start with today's numbers. These are hospitalizations. These are people who are COVID positive between Merit Health Wesley and Forest General in the hospital today. We have 83 people who are COVID positive. That's 10 below where we've been for the last 2 weeks, and of those 83, 28 are in the ICU. A little bit up from where we were on Monday. Again, this is something we're going to have to watch over the next few days to see if that state getting below 80 and then hopefully below 70 is a trend as we wait to see what we're going to do with the next set of executive orders. Statewide today, there were 2,074 new cases with 65 new deaths, and unfortunately, since our last briefing on Monday, we've had 2 new deaths in Forest County. We send our thoughts and condolences to those families, which bring totals now to 126 total deaths in Forest County and 65 in Lamar County. New positive cases for today, Forest County had 64, Lamar County had 68. Totals from since this began last March, 6,324 total infections in Forest County, 5,155 in Lamar. Our 5-day average, kind of a little up today over the past couple of days, getting another day of where the metro area hit over 120 cases. Our inside 14-day number, this is the number of people who have received their positive test result within the last 2 weeks. It gives you an idea of how many active cases you could have in your community. Right now, that inside 14-day number is 538 in Forest County and 484 in Lamar. Bit of a disappointment today. After about 4 or 5 days under 1,000, we went above 1,000 again. And so week over week, slightly above last week with the 60-something new cases today. 525 a week ago, 538 today. In Lamar County, still down 505 last week, 484 today. So still down 8 from last week. Certainly want to get under 1,000 and stay there and head even further down. Hospitalizations, though, again, this is the big improvement that we've seen. 97 were in the hospital last Wednesday, 83 today. ICU is down 1 as well. Our goals continue to be protecting the vulnerable, people over the age of 60, people with underlying or chronic health conditions. We also want to prevent overrun of the healthcare system by slowing the spread. We know that capacity continues to be a concern in both hospitals. And then prioritizing public health while giving the private sector the space to operate. We lean on the widespread availability of testing, wearing masks, watching our own data, and listening to all voices. And of course, today was Wednesday, and so we had our weekly conference call with both our hospitals, our Hattiesburg Clinic, our emergency management folks, both county governments, our public school districts, as well as our universities. And a couple things from Hattiesburg Clinic just to take away. The positivity rate. This is the percentage of total tests that came back positive. The higher this is, typically that's when you get in some dangerous territory with your hospitalizations. We're still well above where we were during the July spike, and so we're still in dangerous territory. However, we're down from that week of January 3rd where we hit 21.4% in positivity rate, which was the highest to date. Our average age of new positives, we want to see this number get lower. While you don't want anyone to get COVID, people who are younger, typically, but not always, but typically, get over it a little bit easier. The highest to date was December 27th, where we had 45.7, but then we've seen some decrease. 42 the week of January 3rd, 42.4 the week of January 10th, 42.9 last week. We have 43, and that is the average age 3 days into this week. This is the big one, too, when it comes to hospitalizations and ultimately ICU and possibly deaths, is that percentage of the new positives who are over the age of 70. This is the one that still kind of concerns us because as we see hospital numbers start to drop, we're still seeing this number kind of in some tough territory. The week of January 3rd, it was 9.5% of new positives were over the age of 70. Then that's increased to 11.9% last week and 14.6% this week. The one thing the question that I posed this morning is as the vaccine becomes more widely available, particularly to people over 75 and 65, shouldn't we see this number go down? And the answer to that is yes. However, understand that after you get your first dose of the vaccine, it usually takes a couple of weeks for you to get about half immunity. Then you go and you get the second shot, and 2 weeks after that, you should be at full immunity to it. So really, it's a 6-week gap between when you get your first shot, assuming you get your second on time, that you are considered fully immunized and fully immune. And so it's going to take us a while, particularly as we get more of our elderly over 65, over 75 in to get the vaccine. There's still a 6-week lag time, and we hope to see this percentage of new cases over the age of 70 come down, which is why it's so important that if you know someone in your family, on your street, in your church, to do all that we can to make sure that we're prioritizing getting them to a vaccination center to get this vaccine. Just one update that we heard today from our local Department of Health, that covidvaccine.umc.edu, that's the website that you go to book a place at Lake Terrace Convention Center. They did encourage folks who have not received a vaccine to check back between 5 and 6 p.m. Each day, because that's when new slots will be opened up. And there won't be a whole lot, but typically, if there are going to be some, 5 to 6 p.m. is kind of when they hit the website. So I encourage you to monitor that. Again, the news on the vaccine changes every week as new supply comes in. We try to share the latest information with you, but that's the takeaway from the day is check back 5 to 6 p.m. each day and see if there are new slots available. Some city news today, a couple of exciting things. We saw our Hattiesburg tax revenues in terms of sales tax have another strong month in the check that we just received a couple of days ago. For the first 4 months of the fiscal year, which started in October, we've been above the previous year. In fact, at the end of last calendar year, we had 4 straight months of record sales tax from August to November. Then in December, we had the highest December since 2006. And then January was above last year. And so another strong month in terms of sales tax for an economy and a city government that really depends on sales taxes. We also got our check for the January use tax allotment. We get this twice a year, January and July. This is from the internet sales tax that was passed by the legislature in 2018. Check was for well over $900,000, which was about $450,000 more than we thought we would get. Of course, that money goes to expenses related to infrastructure, roads, bridges, water, sewer, drainage. Getting a check that was higher than expected allows us to continue the momentum we have in investing in infrastructure in your neighborhood. We also put forward a proposal today that will be considered by the council next week to expand our MOU and agreement with PRCC to help people go back and get workforce training. In 2018, our city council unanimously passed a proposal that would allow any high school graduate who lived in the city of Hattiesburg to go on and go to PRCC tuition free. The county also did the same thing for county residents. We are proposing that we expand this to beyond just recent high school graduates, to anyone who wants to go back and get training or a certificate in an allied health field or a career technical education field. We know that COVID-19 has disrupted a lot of work, a lot of careers, and so a lot of folks are looking for how can I go back and retool, and how can I go back and get a new skill set or a certificate that can help me at the next phase of my career. And so what the city is proposing is that we take some of that CARES Act money that came through COVID reimbursements that came to the city, of that federal money, and reinvest it in our human capital to the tune of just over $100,000 to allow people to go back and get a certificate, or to go and get training in basic manufacturing, or machinist, or surgical tech, or respiratory therapy, those kind of needed skill sets that we have, because we have people who need jobs and need to reskill, but you also have employers who don't have enough employees in our healthcare organizations, at several of our manufacturers in the industrial park. And so there's a need on both sides, and so the city is stepping forward with a proposal that we would use some of that federal COVID money to help bridge that gap and make that connection. So that will go to our city council next Tuesday, and we feel good about what's going to happen there. Our act of courage today is just a reminder that this weekend there's going to be a mask and hand sanitizer giveaway. That's going to be from 8 a.m. to 6 p.m. at the Forest County Emergency Management Office on Highway 11. If you know someone, or if you yourself are disabled, can't get out, call 544-5911. They will deliver one to you. That's 544-5911. But we appreciate Glenn and his staff, again, holding this event, trying to keep people safe. As we continue the week, remember to wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Have a good evening.